Hello all. Thank you so much for making time this afternoon to come to this very exciting open forum. We are super thrilled to have our VACCA and CSnet colleagues, who I'll introduce you in full to in a moment, presenting on this really innovative piece of work. Our registration's, of course, showing your interest, so that's really exciting. I'm Mandy Charman. I'm the manager of the Outcome Practice and Evidence Network, which, of course, as you're probably aware, is part of the Centre for Excellence in Child and Family Welfare. Before we go on, I'd like to acknowledge the traditional custodians of the land on which we are meeting. I'm on the Wurundjeri lands. I live in the lovely Macedon Ranges, so daily I appreciate and feel gratitude for our lands. And I want to pay respects to elders past and present. I'd also like to acknowledge and pay respect to all of the traditional custodians from the lands and water that others are joining from today, and recognise their continuing connection to country and culture. We recognise that sovereignty was never ceded and that this always was and always will be Aboriginal land. So thank you once again. We have a wonderful, exciting session. Today we're going to hear about the great work VACCA is undertaking with CSnet on embedding cultural practices and outcomes as part of the Family Preservation and that's a mouthful, isn't it? Reunification reforms. I'd like to throw now and introduce you to Chia Burke, who is a project lead on implementing cultural therapeutic ways across VACCA. Chia is a proud Yawuru woman with strong ties to her community back home, as well as the Melbourne community she lives and works on. Chia has extensive knowledge and experience in information management, quality improvement in the Aboriginal context of child and family services. Celeste Regan is the Family Services Training Lead at VACCA. Celeste has previously worked as an Aboriginal preservation and reunification practitioner, where she gained experience using CSnet and embedding cultural therapeutic ways within practice. Celeste is a proud Tanarong woman and has strong connections to community, both employed in and accessing services at VACCA. And finally, Mandy Doon is the co-founder and executive director at CSnet. CSnet is an Australian cloud software platform for human services, case management, and outcomes measurement. Thank you so much for making time to present to us today. I'll now throw across to Chia to hear about this great work.
Thank you. I'm just going to share my screen. And of course, just as I start to talk, I've got a tickle in my throat. So apologies if I put myself on mute halfway and need to take a drink. So thank you all for attending today's presentation on VACCA's approach to embedding cultural practice and outcomes into CSnet. On behalf of myself, Celeste and Mandy, I also just want to acknowledge the beautiful lands that we are all presenting on. So we are presenting on the lands of the Wurundjeri, Yagara and Turrbal people. Apologies. I'd also like to acknowledge all elders past, present and emerging, and to also acknowledge the stolen generations, for those who have made it home, for those who are still on their journey and for those who are now in the dreaming, and to acknowledge the amazing strength and resilience of our people. So just a little bit of information on who VACCA is. So VACCA emerged from a long and determined Aboriginal civil rights movement in Victoria in 1977 and has been founded by Aunty Molly Dyer, who you will see on the bottom right of the presentation. So VACCA exists to support culturally safe, strong and thriving Aboriginal communities. The VACCA is an ACCO that supports and advocates for the Aboriginal communities. So we are based in Victoria and the largest of our kind in Australia, providing over 70 programs across the state, such as emergency relief, youth services, out-of-home care, cultural strengthening programs, and many more. I'm now going to hand it over to Mandy from CSnet to tell you a bit about them.
Thanks so much, Chia. As you've mentioned, Chia, what VACCA does is a complex mix of multiple programs funded from multiple funding sources across multiple regional sites. So CSnet works with organisations like VACCA and other human services to solve the problem of wanting to move from siloed data, being unable to see the client journey and unable to measure outcomes for clients and communities across programs. So we do this by providing an organisation with a whole of organisation system so that everything is in one place and that you can make it your own. We support case management, groups, community projects, over 200 different funding programs and sources, and through the CSnet libraries, and that continues to grow. Alongside the work recorded in CSnet from ground up, we support organisations to create and complete surveys and assessments from CSnet that will then automatically generate outcomes against any outcomes framework. The outcomes can be displayed on screen for workers in real time and come out in CSnet reports. We know that implementing a new client information system is hard work and involves considerable change management. And so we're really keen to share with you the work that we've been doing with VACCA now for some years. I thought before I throw back to you, Chia, to talk about your work, it was worth just touching on a bit of background and history. So in terms of how VACCA have implemented CSnet, it's been a planned and staged process that goes way back to 2018, when the first program for Lakijika was implemented. There have been smaller programs that have rolled out since then, but the next big stage of the rollout was in 2020, when VACCA very bravely, during COVID lockdowns, was ready to bring all of their child and family services programs into CSnet. This involved migrating the data from a Victorian government reporting platform called Iris, and working really closely with VACCA and the department to migrate 5 different siloed databases into CSnet to train and go live with more than 90 staff across 6 regional offices. During COVID lockdowns, it was a big job, and workers in VACCA have been absolutely amazing. Having all of these programs and records managed in VACCA's own database in CSnet now, all in one place, supports the leadership of VACCA to make design decisions about how they want to embed cultural practice and outcomes in the way they want it, in the way they see the world. So I'm really pleased to hand over to Chia to talk to you about how VACCA is embedding cultural practice in the work that they do. Thanks.
Thank you, Mandy. So VACCA's approach to embedding cultural practice through CTW, apologies. So Cultural Therapeutic Ways, or CTW, formalises the way that we have been practicing and working with our families for decades. It brings together practice informed by culture, trauma, and self-determination. It guides our ways of working so that people who access our services and staff working at VACCA can expect practice which embeds these 3 pillars. CTW steps us closer to building and formalising an Aboriginal evidence base of our work, the way we've been practicing and working with our families for decades. I think one thing that's really important to note through this all is that CTW isn't new to Aboriginal people, and we've been working this way for many years. However, VACCA in recent years has invested significantly in developing its own internal capacity and expertise to build the Aboriginal evidence of our programs and practice. So working towards VACCA's CTW outcomes. So the CTW outcomes framework measures how CTW is embedded in our organisation. The outcomes framework has 2 parts, so the organisational and community outcomes. Our outcomes framework holds us accountable to the community by making sure our services reflect what people need to heal, connect, and protect. And it supports the health and well-being of staff to be in a workplace that values Aboriginal knowledge and where Aboriginal leadership is prioritised. The outcomes framework allows us to monitor and evaluate how our programs are going and how community members are working towards their self-identified goals. It applies to all stages of the program cycle and means that we are better able to reflect and respond to community needs. Having better data on the impact of programs for Aboriginal children and families is crucial for the bigger project of building an Aboriginal evidence base. So our CSnet build is underpinned by CTW. So the community outcomes allow us to measure our progress in delivering culturally appropriate services and provide goals for clients to work towards. The community outcomes are grouped into 3 domains: heal, connect, protect. each linked with indicators and measures. So we are currently in the phase of implementing the community outcomes with programs, and we have completed this with Child and Family Services, which Celeste will talk on a bit more. So programs choose the outcomes that apply to them as part of a program design and developing a program logic. The community outcomes are built into our case management system, CSnet, to enable us to collect data that produces an evidence base of what works for people using our service. So this evidence will help us to design and improve our programs, but also to allow us to advocate to the government about what Aboriginal people need and how Aboriginal ways would work. A key part of implementing CTW and structuring our programs to deliver on the community outcomes is the way we collect information and capture outcomes. So we needed a fit-for-purpose case management system to do this in a self-determining way. We needed a case management system that we needed a case management system that is underpinned by CTW, which allowed us to custom build our practice. So for example, we now use case notes in a more goal-centered way that is guided by the community outcomes. This means goals are directly linked to achieving better outcomes for the families. So our partnership with CSnet has allowed us to have ownership and control of our data, allowing us to collect meaningful data and giving us the ability to analyse and use our data to tell the story that is important to Aboriginal people and to us at VACCA. With our point of difference, we're putting culture, self-determination and trauma-informed theories as the foundations of how we do our practice. I'm now going to hand it over to Celeste to talk about the practice benefits. Thank you.
Thanks, Chair. So some of the practice benefits when using CSnet, it ensures consistency and best practice across all regions when it comes to collecting, inputting and providing information to families, i.e. sections within CSnet prompt what information needs to be collected by case managers to inform goal setting and work with families. When generating reports, the information that we put in CSnet can be directly transferred into templates and provided to families, such as a family summary, for example. This also ensures a transparent approach when working with families and strength-based and person-centered approach. So in addition to being strength-based and person-centered, it's also holistic. So some of the criteria of information that we add into CSnet involves looking at a broad range of factors that are influencing challenges or strengths of the family at that point in time. So the information we gather, we put into a family's file in CSnet, and it can cover a range of information that in mainstream services and databases it might otherwise be missed or overlooked. So it also leads to family-led goal setting, and it's conducted in a collaborative and strength-based approach that is led by the family and can be generated into reports and templates that are provided to the family, as CSnet mirrors the tools that VACCA have developed that also align with CTW. For example, the family summary, child summary, and footsteps to our future. So this is an example of the family summary template that we use with families. We can then input the data into CSnet and we can customize the language that we use, for example, using worries instead of risks, or that language that is not strength-based and used in services, other services that aren't culturally focused. We can use these tools to empower families as well. So once we generate this information into a report, we then give it to the family so that they can see that we're doing transparent work with them and empower them to work towards their goals. Thanks, Chair. So in terms of the community outcomes survey, this is a tool that Child and Family Services at VACCA use with families. So we use this as a form of data collection to measure outcomes against CTW, and our work with CSnet has enabled us to put this tool into a measurement section on CSnet and ensure and measure that we're meeting families' outcomes and aligning with our frameworks as well. We can also use the reports that are generated as an advocacy tool to demonstrate a family's progress or change over time. Yeah, I think that's it for that one. Thanks, Chia.
Thank you, Celeste. There are really great examples that you've shared with us about how the records of the work from ground up sit alongside the measurement of outcomes to support workers in their practice every day. In terms of how we work together, all of these dot points are really important for us. The requirements of VACCA are unique, and because of the mix of programs, and because you have a really strong view about what tools you want to use, the language that you want to use. So it's really important for our teams on the CSnet side to take time to listen to how the work is done, how you want to express that, and to work together to find the right solution, which is usually a combination of things in a system like CSnet. Like any database, CSnet does have a structure and a language that might be a bit different. So we need to spend time with VACCA around helping users to get used to that, and also to tailor the system so that, as Celeste said, the labels to a large extent actually reflect your language, which is really important. We are really fortunate that our project teams on the VACCA side and on the CSnet side have been consistent since 2018. And that's an amazing position to be in that it makes a big difference when you start to talk to each other about understanding the history and why things were done in a particular way. It also helps to inform around changes going forward in terms of what's been trialled and tested, and where you want to go for the future. You know, capacity for compromise and hard conversations, we think are really positive things. It's about a way of working together in a relationship where we respect and acknowledge that across our teams and across the VACCA teams, it's an amazing multidisciplinary team. And we need all of those perspectives and the skills and the knowledge and the experience to bring together to how we're going to develop a solution which will be right for VACCA right now, and also what might be possible in the future. So the values and the goals alignment, we think, is really important for our relationship. And before today, I was reflecting on how when we became a B Corp in 2015, there was this document and it was called the Declaration of Interdependence. And it's something that we try and keep kind of in the forefront of the way we work with organisations, because it's really a lovely reminder that through this work on big things, we need to do it together, and we need to involve all stakeholders so that people can listen to one another, have a voice around how these systems that are really fundamental for how people work every day and how you can measure outcomes over time. And through that, we think that that leads to much better outcomes for Aboriginal families and communities. So, of course, we're not done yet. We're working on what I think is stage 4 or 5, Chia. Celeste, you might correct me on that. And so during 2023, we'll be rolling out another stage around family violence programs and others. But for us, we really appreciate the way that we can work with VACCA. We admire the work that you've done, and it's amazing to see the system being used in the way it is to be the foundation for the work that you do. So thank you so much. We know that over time, through the learning and the use of the system, being able to reflect on the data and the stories is going to mean changes to the system. So we need to be thinking about how we're going to continue to work in the future around that. And the last thing I really just want to acknowledge is that implementation is hard. It's hard work and it takes time. You can tell from the amount of time that VACCA has been working on this that it does take time, and people need to bring patience to that, and to also acknowledge and celebrate those little wins along the way, because you kind of feel like it's never finished, and that's okay. So thank you so much to Chia and Celeste. I'm going to hand back to Mandy Sharman now, and thank you to Open for hosting us. And we're looking forward to answering any questions that you have. There's our contact details if you want to chat to CSnet about this some more, or to VACCA, there are our contact details. And thanks, Mandy. I'll hand back to you now.
What an interesting presentation. And beautiful, and there's been a whole heap of questions that, of course, been generated, which is lovely when you leave. Your presentation leaves people with just wanting more. So thank you so much. I also love the beautiful display on your slides. I'm going to learn from that, I think. All right, we have a fair few questions, as you would expect. Love the design of your tools. They feel accessible and non-threatening. So common, in our experience, both practitioners and program leaders and clients report feeling uncomfortable with data collection. And as a result of that, often practitioners don't collect because, you know, they feel it sort of feels inappropriate and sort of potentially even damaging to the therapeutic relationship. That's what we've heard. Would you reflect on how your practitioners and those collecting the data and also your families have found the tools and what feedback you've had about that?
I can answer that if you like. So with the tools, we have the templates. Basically, our practice advice generally is to try to use the paper version of the tools rather than taking your laptop out, because we don't want to come across in any sort of way that might be threatening to families. And we complete these tools with the families. We use a very culturally focused and gentle approach in terms of the way we ask questions and gather information. We actually have other tools that support that practice approach in information gathering. So what we do, we take the paper tools out and we complete with the family. We can then take the tool back and input the data into CSnet. And currently we do have some reports that can be generated with that information that can then be printed back onto the paper template, so it fits within the template again. And then we can take that out to the family. That's where I was referring to the transparent approach. So it's actually, you know, the family's language that they have used that go within our case notes as well. And they can see that what they're saying isn't being misinterpreted. And we encourage families to have the templates up if they feel comfortable in terms of the footsteps to the future. So that's our goal setting template, and even the family summary and child summary, if they feel comfortable, just to use as a motivational tool and a reminder. And it does look beautiful. The artwork's amazing. So that's how we use those ones.
Yeah. Really informative. The language, the display. I mean, it just shows all of these things are so important to how people sort of have the experience of this.
Yeah, definitely.
Yeah. An incredible example of having the systems in place to ensure practice is linked to outcomes. What have been the challenges and key enablers for supporting practitioners with this way of practicing and ensuring or supporting consistency with how the information is documented?
I feel like we can kind of co-answer this. Yeah, so I guess I can talk on in terms of the implementation of cultural therapeutic ways to the whole organisation and implementing the community outcomes. It is a practice change, and it is a change in that VACCA are now using their own case management system with CSnet because majority of our programs use external systems like Irishship and so on. And so we've never had, data sovereignty from that. And so having this change in terms of implementing CTW, but then secondly, implementing a new case management system. There are challenges with that because they're learning a whole new system and how they do that, and how do we ensure best practice and getting the data that is needed. And also, I think just going back to what you were saying before, Mandy, around, people sometimes won't put the data in, or it can get, it's too much. And so another thing in terms of how we're trying to support staff and with that practice changes, that you're actually telling a person's story. All the data you are collecting, that's an individual person's story. We work in, for instance, the out-of-home care sector as well. That's a young person's life that you are supporting. When they turn 18, they have access to that information. We want to ensure that when they leave the out-of-home care sector, that we have done right by them, that they have their life story there. So it's really making staff see why it's important that we are doing this, that yes, we want to achieve, apologies, these outcomes to better our services, but at the same time, the end goal is that we want to ensure that community member is safe, loved and supported, that they have gone through a service that has given them what they need, and that they are able to take that, that data or that story or that information in their file and really see that they were supported through their journey, that they were listened to, that the goals that they wanted to achieve were heard, versus the other way around where we're saying you've got to do this, you've got to do that. We want to ensure it's a holistic approach, that it's centered around them, not the other way around. So I'm not sure if you wanted to add anything else to that, and apologies if I've derailed the question as well.
No, excellent. It was excellent, thought-provoking answer.
Yeah, no, I think that was great, Chia. I'll just echo that, yeah, obviously there are challenges when you're trying to implement a new process or tool. And we did a lot of training in terms of practice approach when completing this tool with families. And I think it's just really about aligning the purpose of the tool, what's the purpose of collecting the data, and how our other tools and case management cycle and CSnet all align to make sense. So one piece of work informs another piece of work. For example, meeting community outcomes, that's linked to our goal setting work. So it's not meaningless, if that makes sense.
Yep.
That's about all I'd have to add to that.
Yeah. Centering your young people so that their record is actually a historical record for them rather than a record for the worker is, really fundamental. And I know there's some important work going on in mainstream out-of-home care around the same thing. Just really interesting. You mentioned, Celeste, integrating or making the different types of data you collect sort of work together. And the next question sort of about an interest in how you evaluate your case notes and how that is sort of integrated into that.
Yeah, so currently at this point in time, in terms of the community outcome survey, we are collecting data. It's in the early stages. So we've done the training and some implementation work. We encourage 3 points of data collection. So we're nearing probably the point where we're getting to the third stage from the initial implementation of that. And then we'll be evaluating that and the survey to see if there's any changes that we need to make and the outcomes are being met. In terms of case notes, currently VACCA have an internal CQI team that CSnet has actually contributed to making it easier, I suppose, in terms of finding that information's being put into the correct places, and then the CQI team will do audits on a regular basis in terms of that data being input into the system correctly.
Yeah, I think there's so many layers to this conversation, isn't there? And your half-an-hour presentation just showed it so beautifully. And then you could drill into any aspect of this, and there's a whole story behind it. We have Tom saying, thanks for sharing this amazing work. Just to confirm, is the Community Outcomes Survey the basis for both individual goals-based case management planning and can be analysed for aggregated progress towards community outcomes? Is there any examples of how VACCA are using or planning to use the outcomes data?
So we do have a separate tool and process and section within CSnet that we do our goal setting specifically. But as I mentioned earlier, we do the community outcomes survey, which can inform the goal setting and the progress that the family are wanting to work towards. So the community outcomes survey is a range of questions that cover different cultural aspects that would then inform the goal setting. And what was the second part of that question? Sorry, Min. Was it in terms of what we were going to do with the data?
Yeah, how are you reporting and using the outcomes data you're collecting?
Yes, so currently we're just collecting it and we'll be evaluating it soon. And then CTW are doing a lot of work in terms of, I don't know if you want to talk to that, Chia. So we would, look to make sure that that Child and Family Services are delivering the services that community want and need and meeting outcomes. And then we'd look at our internal frameworks and whether that's aligning with the frameworks that Chia's been working on. If you wanted to talk to that more, Chia.
As Celeste has said, so the community outcome survey tool that we use is only for adults. So it's specifically designed for the use with adults only. So what we are actually going to be doing as well is that's going through a review soon, and it's going to support the development of a youth survey tool and also one for children. And apologies, I've forgotten the age range, but we've identified that we can't just have one youth survey tool that covers all children under the ages of 18, and that there are complexities we need to take into account. So we've got the review happening and what comes from that, but also consulting with practitioners within our healing team to support us with ensuring that the additional tools we are creating to measure these outcomes are appropriate for the age demographics we're needing them for. But also in terms of us reporting, we're using this so that we can better improve our services when we are implementing it with other programs. And it is something that we are also using to support the building of an Aboriginal evidence base as a whole organisation. And we hope that this information can be used and to support other ACOs as well. And I think that's really important to acknowledge, is that the work that we're doing here isn't just for VACCA. We want to ensure that this work is shared with all ACOs. You know, we can't do the work that we do without other ACOs supporting each other. So having spaces like this and being able to share this with other ACOs and have partnerships with ACOs is so crucial to ensuring that outcomes for communities are met. And so I hope I've answered your question, Tom. If we haven't, please feel free to also email us if you want to know any more.
Well, you might regret saying that, mate. This is an excellent lead way into, do you think that this kind of system would be appropriate for other ACOs? And what would some of your key lessons, and I'm sure there'll be people here who are in various ACOs, what would your key lessons be to those? Those people?
Yes and no, only because, you know, it has to be acknowledged we're very fortunate, and as I mentioned in the presentation, that VACCA has recently invested within this space. A few years ago, it was a brand new space for VACCA, and we do have a dedicated research and evidence team that support the monitoring and evaluation of all of this. But we also need to acknowledge that, there are some ACCOs who might not financially have that support or be able to implement in the way that we might have done. But it doesn't take away from the fact that the heart of what we're trying to do can be done in all ACCOs. What we're trying to do is just formalise Aboriginal ways of doing business. The ACCOs have that information. They know what works for the communities they're working with. And now it's just about, well, how can we formalise that? And, working in partnerships with other ACCOs to do that, I think, is a central way in how we can keep that going.
Yeah. Because there'd be a huge relevance and transferability across.
Yeah, yes,
there.
definitely. Yeah, exactly.
Yeah, that picks up another. You're doing so beautifully navigating through our questions without even knowing what they are. We do have a question around, can we better understand how therapeutic principles are captured within your data? So that's getting into what those are and, what mechanisms you use to capture that information. Just a little bit more about the therapeutic principles, if you would mind.
Celeste, do you want to answer that one? I think I'm stuck on the therapeutic principles, that's all. The language.
I think maybe that language is a little bit tricky for me, if there's another term.
Could you just enlarge upon your cultural therapeutic ways? What's captured by that?
Yep. So just a bit more on like what cultural therapeutic ways is. Yep. So CTW has actually, the project itself launched in 2018 to all of VACCA, but the work itself, I think, to be honest, it's probably 20 years in the making. And two key people to acknowledge in that is Sue-Ann Hunter and Kerry Stringer, who really got this off the ground running, and realising the need for ensuring that practitioners coming in had the tools and resources to be able to work with families, whether they were Aboriginal or non-Indigenous staff members. People who come to work in ACCOs, I always say, you don't come in for a paycheck, because, you come in because there is a love and a passion for the work that you're doing. But we need to ensure that we are supporting those staff to do that work. And that's where cultural therapeutic ways has come about. We saw that there was a need to formalise and document all this amazing practice wisdom and this cultural knowledge that people saw, but also to acknowledge the cultural load that Aboriginal staff members do have. And we want to ensure that they can still go out and do the work that they're doing, and that a non-Indigenous staff member can also do that and be confident to do that work, because they are supported with a practice framework, with an outcomes framework, with practice tools that allow them to do the work that they need to do. I hope that answered that for you, Helen. I think it was it Helen asking that? No, Simone, apologies. So I hope I've answered that. I won't say the whole thing about the email, because apparently that's not good, but yeah.
Oh, no, that's excellent. We'll come to that at the end. I was just thinking, you might find people.
I'll get too many emails now.
Oh, yes. But I mean, everyone wants to share in this great work. So
exactly.
We have had a comment from Helen that ATSILS in Queensland has also been implementing CSnet and has found it really great. I suppose I'd be interested to ask Mandy, I mean, you've gone on this journey as well and have had experiences with doing this type of work with other Aboriginal controlled organisations. Just your reflections on some of the highlights and perhaps what you've taken out of learning, because it's always a relationship and an exchange, isn't it?
Yeah, it absolutely is. And say hi to Helen. That particular program, Through Care, it's interesting how we got to work with ATSILS in Queensland and now in the Northern Territory. And really it was through VACCA. because VACCA also has a youth through care program. And this is, I think, a really lovely example of how when people through their communities of practice can talk about what's working and what they want to do with the system, then they can share some of that knowledge, and then that can also be used as input to their system. So those new organisations, basically their CSnet is configured in the way they want to for their particular programs, but it can pick up on the learnings and the themes and cultural ways in a way that makes sense to them in their context. I think what we've learned is just it takes as long as it takes, really. You can go really fast and implement a system, but we know that the resources required and the thinking and design on the side of the is real. And it's really important for us to acknowledge that and to work with organisations in a way that will suit them. So I think that's a really important learning, and we really appreciate that it is usually something on top of everything else people are doing. But I think when you hear the stories like VACCA and from ATSLS too, is people start to see the benefits over time. And when you start to see the benefits, it is really a concrete thing. It's on the ground, what I do every day and what I see on screens, how I can communicate that with clients and families. And that's really important.
Yeah, it's really powerful, isn't it? So once people get turned on to this type of work, they don't turn away again, I think. And if you can do that at an organisational level, I mean, I just think that's astounding. We've had a number of questions, and I'm just going to group them together. This is really about the practitioners, the experience of practitioners have not seeing, because I don't think, just with the additional burden and requirements in their already busy sort of workloads, because we know practitioners are really mostly overcommitted. And you talked about this a little bit, but wondering if you can enlarge a little bit more on the supports or mechanisms or tools that you might have used to try and support practitioners manage that additional requirement?
Yeah, so we did a lot of implementation work when we rolled out the tools in terms of how they sit within CSnet as well and how to use them in practice. So myself and one of my colleagues facilitated a training. So we've got that up on our LMS. We also developed some resources in terms of practice approaches, a CSnet guide of frequently asked questions document. So they're typical barriers that pracs might face when administering the tools with families. So with some solutions to follow the questions. So there's some of the strategies we use. We also did some regional check-ins with the pracs in each region. We did some work through some case studies. And I think a big part of it as well is trying to flip that that feeling of it being an extra thing to do and an extra burden, but realizing how it will inform not only your work with families, but it's a motivational tool as well. And as we know, the more motivated a family is to work towards goals and make changes, then it's going to take away from other parts of work that that might be more time consuming if a family's facing more barriers and aren't feeling motivated to want to make change. So I hope that answers the question. And then, yeah, obviously we just do that sort of ad hoc support where people have questions or are facing challenges. We just, people can reach out to us within the org and
Do you, it's an excellent point about it being a motivational tool in its own right for your clients and your families. Do you actually provide sort of the results back or reflect, use the results and shifts and improvements in that way, in the therapeutic way, I imagine? Yeah.
Most definitely. So one of the key practice points when using specifically the community outcomes survey we do that, as I said, with the family. So they rate where they feel on a scale in terms of each question and domain that aligns with the CDW community outcomes. And within most family services programs, we do 3 collection points. We obviously don't use that language with families, but so we do a start, middle and end point. And with the reports that we can generate on CSnet, we can then take that to the family, say when we're doing a 3-month review or something with the family, and say, oh, well, look, you know, like you said that you really didn't feel comfortable or connected to your community, and look how the work you've done and how you've progressed, and look where you're at with that now. So sometimes they may not realize the progress that they've made, or how they're rating, how they're feeling, basically. So that's how we do use that with families.
Yeah. And therefore there is an immediate purpose for your practitioners, because they can see the value, and it creates a stronger rapport and recognition, achievements of the families.
Even just the questions within the community outcomes survey, it was a point that was made when we were doing the training, that some of these questions may not have ever been asked or considered with the family. And we all know, like, culture is a real strength, and healing people's trauma and working in a culturally informed way will always bring up that discussion and inform the goals that we then use the footsteps template. So they'll bring up, discussion in terms of informing goals. So that's how we.
Yeah, wonderful. We have an interesting question here, and I think it really goes, the question itself is, does this mean VACCA will no longer be using the CRISP or CRISP system? And I think that goes to a much bigger question about the way VACCA and CSnet have sort of navigated relationship with funders, because we all know how that can affect and sort of shape an organisation's effort in the data collection space. And yeah, I wondered if any of you would comment on that.
Yeah, that was a big factor for us. We acknowledged that in our consultation in finding a new case management system, staff were doing double data entry. They were doing it into the client's paper file, and then also into SHIP Iris or wherever it was that they were storing their data. And that was something that for us, it was too much admin time, and we saw that they could be spending that time with that family. So when we started our work with CSnet, it's been amazing, the partnership, to say that we want to advocate to say, this is the system we're wanting to use. This is where staff are going to enter the data. They're not going to do double data entry. But we will give you the reports you need, or the reporting requirements that you need to meet our targets, KPIs, or whatever it is. So we have a case management system that works really closely with Tracy from CSnet and supports that work. So right now, the way we have it is that any of the requirements that are needed for IRIS, they're all built into CSnet. And anything in terms of a client's paper file, whether it's an original document or, for instance, court papers or anything that needs to still be in a paper file, the community member still has that paper file. And if we need to, if we've been need to go to court, or the person would like a copy of their file, all of that can still happen. It just means now there's one central database that the staff are using, and that the requirements that need to be sent off to whoever it is are sent off. Mandy, I'm not sure if you wanted to add anything else at all.
Yeah, thanks, Chair. I think there's a really interesting point, and it comes back to our interdependence, doesn't it? In that we're trying to solve a problem where there's this workload for workers if they have to do duplicate data entry. So one of our key strategies in CSnet has been to build the integrations as best we can. And that's been led by our organisation saying to us, integrate to this, can you integrate to that? And so we've built, I think, 8 or 9 different integrations to try and take some of that load and burden away from workers, so then they have the space to start to think about their practice and measuring outcomes. And we'll continue to do that. And so, you know, being open to being able to do that with government agencies is really important. At the moment, one of the trials that VACCA is involved in as well is building the integration between the Orange Door and CSnet, so that referrals will go smoothly one way and the other. The integration to Iris in Victoria is really important for taking away some of that burden of data entry. We integrate real time with DEX, with the alcohol and drug system, VADC. If you're in New South Wales, with InfoShare, we're always looking for these opportunities to integrate to make that that burden less. So whenever a government agency is open to thinking like that and being able to work with us through our organisations, we're really keen to talk about that, because we can see it's such an important part of the puzzle.
Yeah, and being negotiating that arrangement then creates more availability, because I can see the advantage of being able to present your own defined outcomes and showing that sort of structure, because really reporting requirements fill the space of funders wanting to know how things are tracking. If they're also already meaningful reporting requirements, I sort of intuitively feel that funders would be much more responsive to arguments that you set your own outcomes and your own reporting requirements, because they're probably more meaningful than those arbitrarily set over here anyway, no offense to funders. But yeah, would that be something that you would be consistent with your practice?
Yeah, definitely. You know, I think one thing we've found with this whole process is that the data that funding agencies are needing, usually, not all, but usually it is numerical counts, and it doesn't really have a story behind it as to, well, why is it that number? And there are so many reasons why it is that number. Has the family disengaged? Well, why? Why did the family disengage? Oh, because they couldn't actually come to the service. It's not because they didn't want the service. So there are so many factors to those numbers, and that's, for us, what's important is actually deep diving down to the why and how can we ensure that that doesn't happen again. So it allows us to better our service and better advocate for whether it's more funding or, you know, advocating for a better way in how we do the service.
Yeah, exactly. Now we've got just 5 more minutes left, and I think I've managed to cover the main questions. I suppose I was really interested, often at this point you go, what's next? What's your vision? You've worked really hard for a very extended period of time to get to this point, and I can only imagine the journey you've been on. If you had your wherewithal, the best possible success you could have, where would you take this? What would be next for how this work progresses?
Well, we're still implementing across the 70 plus programs we do have in VACCA. So I guess for us, you know, is implementing to all programs and then being able to actually, you know, in the years to come, use that information to share it with other ACOs, share it with mainstream organisations, you know, to develop practice tools that are culturally appropriate, that are trauma informed, and that are providing self-determination to communities, and being able to share that with the rest of you know, this sector. I think that's important, because how can we I guess, you know, close the gap on you know, what's happening with Aboriginal people if we aren't coming together as one to achieve that goal? You know, it'd be amazing to be able to do all of that. It's going to take time. You know, this project has been going for a number of years. And as Mandy has mentioned, it takes time. You need to give respect to that. And you can't just assume that practitioners are going to be able to pick up the practice changes or the changes we are putting forward. So you need to actually give respect to that and support them and guide them with that. And I think through that will allow us to have this amazing end project that we can then share to all, and hopefully in years to come we are presenting again and it's sharing, you know, the outcomes from this project and sharing the resources to say this is what we did and this is what we found worked, and we would want to share it with you and hope it works for you. You know, that'd be amazing to do, you know, in the years to come. But we also acknowledge that, you know, that's still years away and we're still learning, and this is a forever learning process where you don't just get it right the first time. There's always speed bumps along the way, but they're so important with the implementing of cultural therapeutic ways and of the community outcomes, because it allows us to better how we do it for, you know, the next programs. But then to go back to the previous programs and also, you know, amend it there as well. So that would be, I guess, the, you know, overall achievements would be wonderful. I don't know for Mandy and Celeste if there was anything else.
I think that was great, Chair. I think just, yeah, building the Aboriginal evidence base, and then, you know, once we have all this data, we can then use it to advocate and shape funding and services the way that they, you know, would be in the ideal world. So
Yeah, thanks, Celeste. And look, from our perspective, it's to continue to support organisations to do this amazing, innovative work and to encourage people to learn, we say get going, get better, because it's never going to be perfect. You've got to start somewhere. And I think the key is to be a learning organisation and to take the data and the stories that you can get now and reflect on it and use it as a way of improving. And we're really excited about continuing to do this work because it's so valuable. And we thank you, Open, for helping to facilitate this conversation. It's been lovely.
It's been an absolute privilege. Such powerful comments from all of you. Thank you so much for so freely sharing your learnings and where you are on your journey. And we will have you back in a heartbeat anytime you want to give us the next instalment of how things are tracking. We will share this recording first with our participants and those who have RSVP'd, but any materials that we could attach, we always do an event recording and reflection. So we'll send that to you guys just to check, and if there is anything you'd like to share in terms of snippets of your work. Thank you once again. If anyone left is happy to fill out our survey, that always helps us in terms of knowing whether we've hit the mark, how we can improve. And it's wonderful to get great feedback for our presenters as well, because that always makes the effort, because this does take an effort to present at something like this. So thank you very much for investing that time in sharing with all our colleagues across all the various aspects of this very diverse sector. Thank you, and everyone who was in attendance and made such a pleasant discussion, contributed so well to our discussion.